Okay, so today we're diving into something that is absolutely vital, but we don't often think about it a whole lot.
Right.
It's kind of invisible most of the time, and that is how our bodies stop bleeding.
Yeah.
And the kind of the amazing complex system that is always going on behind the scenes to make sure that we don't bleed out every time we get a cut.
Absolutely.
So we are talking about hemostasis and coagulation.
That's right. And for anyone out there who really wants to get a grasp on how their body works, this is like a fundamental process.
Yeah.
This is how we plug leaks. And so we're going to go deep on what are all the steps the body takes and then what can happen if that system gets disrupted.
And for our listeners, just so you know where we're coming from with this deep dive,
Yeah.
we are using source material from the medical and nursing field. So specifically, material that's used to teach about coagulation disorders and the agents that are used to manage them.
Right.
But we're trying to pull out the core principles and make it very clear how this all works. So really, how blood clots form and how they break down, and what are the different types of medications that can affect this process?
Yeah. So it's not going to be just a list of drugs and how they work. We want to connect those drugs back to this overall system
Right.
to get those aha moments.
Yeah, exactly.
Where you understand why a drug is going to have a particular effect.
Exactly. So let's imagine you get a cut.
Right.
What is the very first thing that happens in your body?
Well, the first thing that happens is the body says, oh, no, we got to stop this bleeding right away. And it initiates this rapid damage control sequence that we call hemostasis.
Okay, so hemostasis is like the immediate first aid response
Exactly.
to a cut or any kind of injury that's causing bleeding.
Right. And the very first thing that happens is vessel spasm.
Okay.
So the injured blood vessel will constrict.
Oh, so it gets narrower.
Exactly. It narrows.
Yeah.
It tries to reduce blood flow to the area.
Just like squeezing a hose
Yeah,
to
exactly.
kind of slow down the leak.
Exactly. And then hot on the heels of that initial constriction, the next critical step involves platelets.
Okay.
So these are these tiny little cell fragments in your blood, and they rush to the scene of the crime, and they start to stick to that damaged area of the blood vessel.
Oh, so they're like little sticky bandages that are just trying to cover over that spot.
Exactly. And as they do that, they start to clump together and form what we call a platelet plug.
So is that platelet plug kind of a temporary seal?
It is a temporary seal, but it's not the long-term fix.
Okay.
I think of it as a dam that's made of twigs.
Yeah.
It's not going to hold back a flood.
Right.
And so our sources indicate that normal clotting time is about 6 minutes.
Okay.
And these initial hemostatic responses, they're already starting to happen within that window. So very quickly preparing that area for a more stable fix.
So then what's that stable fix?
So the stable fix that comes in is called the coagulation cascade.
The coagulation cascade.
Yeah, it sounds very fancy.
It does.
But it's really just a series of chemical reactions that ultimately lead to the formation of a stable fibrin clot.
Okay, so this is like a stronger, more reinforced barrier on top of that little flimsy platelet plug.
Exactly. And so there's several key players here that act in a very specific sequence to make this happen.
So tell me about the players.
Well, so when cells are injured, they release this substance called prothrombin activator.
Okay.
Now, prothrombin activator, think of it as a key.
Okay.
It's a key that unlocks this inactive form of an enzyme called prothrombin, and it turns it into the active form called thrombin.
Okay.
Now, thrombin is really crucial because thrombin's job is to take fibrinogen, which is this soluble protein that's just floating in your blood, and convert it into insoluble fibrin strands.
Okay.
So fibrin is really what becomes the structural component of the clot.
So it's the solid part.
Exactly.
Right.
These fibrin strands, they're kind of like long, sticky threads,
Okay.
and they weave together, forming a mesh or a web right over that injury site. And so this web, it traps blood cells and platelets and further solidifies that plug to create a really robust barrier.
Okay.
And that's what stops blood flow.
So hemostasis is a complex process.
Oh, it's extremely complex.
And it involves all these different enzymes and factors that have to act,
It's like a cascade.
right, in a particular sequence.
Yes.
But the final product is that fibrin clot.
That's right. And that fibrin clot is what really plugs that leak.
Okay, so we've successfully stopped the bleeding. We've built this clot.
Right.
But we can't just have clots hanging around forever.
No.
So what happens next?
Well, the body has to have some way to get rid of that clot.
Right.
And that process is called fibrinolysis.
Fibrinolysis.
Yeah.
So that's clot removal.
Exactly. So how does that happen?
So fibrinolysis typically begins about 24 to 48 hours
Right.
after that clot has formed.
Right.
And what happens is the body releases this substance called tissue plasminogen activator.
Oh, TPA.
Yeah, TPA.
And TPA acts on another protein called plasminogen, and it converts it to plasmin.
Okay.
Now, plasmin is an enzyme that basically acts like molecular scissors.
Okay.
It digests those fibrin strands.
So it's breaking down the clot.
It's breaking down the clot, allowing blood flow to be restored once that vessel has been repaired.
Okay, so TPA is like the signal to start demolition, and plasmin is the demolition crew.
Exactly.
Okay.
That's a perfect analogy.
Right.
And this is important because the body has to regulate this process very carefully.
Right.
You know, it needs to get rid of unwanted clots that could block blood vessels and cause problems, but it also needs to leave fibrin in the wound for a while
Right.
to make sure it heals.
So it's a balancing act.
It's a very delicate balancing act.
So we've got this really fascinating self-regulating system to make sure our blood clots when it needs to clot and it doesn't clot when it doesn't need to clot.
Right.
But we also have a bunch of tools
Yeah,
that can either enhance that clotting process or inhibit it.
exactly. And that's really important because, you
Yeah.
know, we know sometimes that system can go wrong.
Right.
And so we need to be able to intervene.
And our sources list several categories of drugs
Yeah.
that are called coagulation modifiers.
Yeah.
Let's start by talking about anticoagulants.
Okay.
What do those do?
So anticoagulants are a class of drugs that work to prevent blood clots from forming,
Okay.
or if they've already started from getting any bigger.
Okay.
And they do this by inhibiting specific clotting factors
Okay.
within that coagulation cascade that we talked about.
Right.
So they're basically slowing down or blocking those steps that lead to fibrin formation.
Okay.
And they are primarily used in the veins
Okay.
to prevent and treat thromboembolic disorders.
Okay. And those are basically disorders that are caused by
Clots that can break loose.
clots that can break loose and travel.
Exactly, and cause blockages.
Okay.
Somewhere else.
Got it. Okay. So our first prototype for anticoagulants is heparin.
Okay.
What are the key things we need to understand about heparin and how it works?
So heparin is a parenteral anticoagulant.
Okay. So it's injected.
Right. It's given by injection or IV.
Okay.
So it bypasses the digestive system.
Okay.
And one of the things that is really important to know about heparin is that it has a risk of abnormal bleeding.
Right. Because it inhibits clotting.
Exactly. It inhibits clotting.
Yeah.
And there's also a risk of this very serious condition called heparin-induced thrombocytopenia, or HIT.
Okay.
And what's interesting about HIT is that it can actually cause a decrease in platelets.
Oh, wow. So it causes more clotting.
Well, it can actually lead to an increased risk of serious thrombosis.
Oh, wow. Okay.
So in some people, heparin can paradoxically lead to clots.
Interesting. Okay. So are there other major warnings or things we need to watch out for with heparin?
Yeah. So there's a black box warning
Okay.
regarding the risk of permanent paralysis
Oh.
from an epidural or spinal hematoma.
Okay.
So this can happen in patients who receive spinal anesthesia or undergo a lumbar puncture while they're also on heparin. And it can cause compression of the spinal cord leading to paralysis.
So very serious.
Very serious, and requires very careful monitoring of neurological function.
Okay.
So there's also a number of contraindications for heparin.
Okay.
So situations where you would not want to use it.
Okay.
So those include active internal bleeding,
Okay.
any known bleeding disorders, severe high blood pressure, recent trauma,
Okay.
intracranial hemorrhage, so bleeding in the brain,
Yeah.
and a heart infection called bacterial endocarditis.
Wow. That's a lot of contraindications.
It is.
So it sounds like it's a medication that really requires a lot of careful consideration.
It does.
Okay. What about drug interactions or other substances?
Yeah, so there are quite a few potential drug interactions.
wow.
The risk of bleeding may be increased by drugs such as aspirin,
Okay.
indomethacin, ibuprofen, and then there's also some herbal supplements that can increase the risk of bleeding.
Oh, like what?
Things like ginger and garlic and green tea and ginkgo.
Oh, wow.
All of those have some effect on blood clotting.
Interesting. Okay.
Conversely, things like nicotine, digoxin, tetracyclines, antihistamines
Okay.
may reduce the effectiveness of heparin.
Okay.
And then heparin can also affect some lab test results.
Good.
And importantly, heparin is a pregnancy category C drug.
Okay.
And if there's a heparin overdose, there's an antidote
Oh, okay.
called protamine sulfate.
Okay. That's good to know.
Yeah.
All right. Let's move on to our next prototype anticoagulant, which is warfarin.
Okay.
How does it differ from heparin in terms of how it works?
So warfarin is an oral anticoagulant.
Okay, so it's a pill.
It's a pill.
Okay.
And one of the key things to know about warfarin is that it doesn't work immediately.
Oh, okay.
It takes several days to reach its full therapeutic effect.
Okay.
And its anticoagulant activity can last for up to 10 days,
Oh, wow.
even after somebody stops taking it.
Okay, so that's a lot longer than heparin.
Yeah, much longer.
Okay.
Which is important to consider.
Right.
If someone needs to have surgery or another procedure.
Okay, so what are the major concerns or warnings associated with warfarin therapy?
So warfarin also has a black box warning
Okay.
for the risk of major or fatal bleeding.
Okay.
The contraindications are very similar to heparin,
Okay.
with the addition of severe liver or kidney impairment,
Okay.
because those can affect how the body processes the drug and increase bleeding risk.
Okay.
So one of the interesting things about warfarin
Yeah.
is that vitamin K actually counteracts its effects.
Oh, wow.
So that's important to know in terms of diet,
Interesting.
but it also highlights the checks and balances the body has.
Right.
You know, even when we introduce this external factor,
Yeah.
the body has its own mechanisms
Yeah.
to try to keep things balanced.
Okay, so there's a lot of potential drug interactions
Oh, yeah, there are many.
with warfarin. What are some of those?
So things like alcohol, NSAIDs, diuretics, certain antidepressants,
Okay.
steroids, antibiotics, vaccines,
Yeah.
and even some vitamins can increase the effects of warfarin.
Oh, wow.
And then conversely, things like foods that are rich in vitamin K,
Okay.
like leafy green vegetables, broccoli, liver,
Yeah.
can actually reduce the effectiveness of warfarin.
Okay.
So warfarin is a pregnancy category X drug,
Okay.
meaning it's contraindicated during pregnancy.
Right.
It can cause birth defects.
Yeah.
There's also an increased risk of bleeding when warfarin is taken with herbal supplements,
Oh, such as
green tea, ginkgo, garlic, cranberry, chamomile, ginger.
Okay.
And then the treatment for a warfarin overdose is vitamin K.
Okay, interesting. All right, so we've talked about anticoagulants. Now let's switch gears a little bit and talk about antiplatelet drugs.
Okay.
How are they different?
So while anticoagulants primarily target that coagulation cascade,
Okay.
so that series of protein activations that lead to fibrin,
Right.
antiplatelets work by prolonging bleeding time,
Okay.
by interfering with platelet function,
Okay.
so their ability to stick together.
Okay.
And they're often used to prevent the formation of thrombi in arteries, particularly after events like a heart attack or stroke,
Okay.
where platelet activation plays a bigger role in clot formation.
Got it. Okay, so our prototype for antiplatelet is clopidogrel
Okay.
or Plavix.
Yes.
What do we need to know about that?
So clopidogrel, like aspirin,
Okay.
has anticoagulant activity
Okay.
by inhibiting platelet aggregation.
Okay.
Some of the adverse effects include flu-like symptoms, headache, dizziness,
Okay.
bruising, rash, itching, and an increased risk of bleeding.
Okay.
There's a black box warning
Okay.
for clopidogrel regarding an increased risk of cardiovascular events,
Okay.
such as stroke, heart attack, and death in patients who are poor metabolizers of the drug.
Okay. So poor metabolizers meaning they don't.
Their body doesn't activate it effectively,
Okay.
and it's contraindicated in patients with active bleeding.
Okay.
So generally, it's advised that the tablets shouldn't be crushed or split.
Okay.
And it's also recommended to discontinue clopidogrel at least 5 days before any planned surgery
Okay.
due to that increased risk of bleeding.
Okay. And are there a lot of interactions with other drugs?
There are quite a few.
Okay, like what?
So the risk of bleeding is increased if you use it with other antiplatelet agents,
Okay.
thrombolytics,
Right.
and SAIDs.
Right.
And some drugs can actually increase the anticoagulant activity, like
Okay.
barbiturates, rafampen, carbamazepine.
Okay.
And then others can decrease its effectiveness.
Like.
Things like achazole antifungals, certain HIV protease inhibitors,
Okay.
erythromycin, verapamil, fluoxetine proton pump inhibitors.
Wow, that's a lot. Okay.
It is.
And then same thing with herbal supplements.
Yeah, so there's an increased risk of bleeding if you combine it with green tea, ginkgo, fish oil, ginger, or garlic.
Okay.
It can also cause some gastrointestinal upset.
Okay.
And there's a possibility of increased menstrual bleeding
Okay.
in women.
Got it.
Clopidogrel is a pregnancy category B drug.
Okay.
And in the event of an overdose platelet, transfusions may be used to help restore clotting.
Okay, so that's good to know. All right, so we've talked about medications that prevent clots from forming or getting bigger.
Right.
What about if there's already a clot there that we need to get rid of?
So that's where we would use a thrombolytic
Okay.
So thrombolytics are drugs that actually dissolve existing blood clots.
Good.
And they do this by converting plasminogen into plasmin,
Right.
which, as we talked about, is the enzyme that breaks down fibrin.
Okay.
So because of this, they're typically reserved for very critical, life-threatening situations
Okay.
involving large blood clots,
Okay.
such as a heart attack,
Yeah.
deep vein thrombosis,
Okay.
acute ischemic stroke, pulmonary embolism, and severe arterial thrombosis.
Okay, so those are pretty serious.
Yeah, they're very serious conditions.
Okay, so our prototype thrombolytic is alteplase,
Okay.
also known as Activase.
Right.
What do we need to know about that drug?
So the major adverse effect with alteplase
Yeah.
is abnormal bleeding,
Right.
which makes sense given
Yeah.
that it's breaking down clots. It's contraindicated in patients with bleeding disorders,
Okay.
recent trauma, or recent surgery.
Okay.
Now, for alteplase to be effective for things like heart attack and stroke,
Yeah.
it has to be given within a very specific time frame.
Okay.
So generally within 12 hours of the onset of MI symptoms,
Yeah.
and ideally within 3 hours of a stroke,
Okay.
and sometimes up to 4.5 hours for certain stroke patients.
Wow, so it's a very tight window.
Any tight window.
Okay.
During an infusion, you also want to avoid any unnecessary injections
Okay.
to minimize bleeding risk.
Yeah.
The risk of bleeding is also increased if you use it with antiplatelet agents,
Right.
anticoagulants, NSAIDs,
Right.
and those same herbal supplements that
Yeah.
we've talked about before.
Right. Green tea, ginkgo, all this.
Exactly. Green tea, ginkgo, fish oil, garlic.
Okay.
Alteplase can cause an increase in PT and PTT lab values,
Okay.
which are measures of blood clotting.
Okay.
And it's really important to monitor level of consciousness because of the risk of bleeding in the brain.
Mhm.
Alteplase is a pregnancy category C drug.
Okay. All right. So we've covered all these drugs that prevent clots from forming or getting bigger, and then the drug that breaks down clots if they're already there.
Right.
Our final category of drugs are hemostatics.
Yes.
And these seem to be the opposite of thrombolytics.
Exactly.
They actually help promote clot formation.
That's right. So they're used in situations where there's excessive bleeding
Okay.
and the body's natural clotting mechanisms aren't enough.
Okay.
So our prototype here is aminocaproic acid.
Okay. Also known as Amicar.
Right, Amicar.
Okay.
So some of the adverse effects include hypotension,
Low blood pressure.
low blood pressure,
Okay.
and bradycardia.
Slow heart rate.
Slow heart rate, particularly when it's given by IV.
Okay.
It's contraindicated in patients with thromboembolic disease.
Okay.
DIC, which is disseminated intravascular coagulation.
Okay.
That's a condition with widespread clotting and bleeding, and severe kidney impairment.
Okay.
Now, aminocaproic acid can elevate potassium levels.
Okay.
So we need to monitor that with blood tests.
Okay.
If it's given by IV, we need to monitor for arrhythmias
Okay.
using a cardiac monitor.
Okay.
Concurrent use with oral contraceptives or estrogens may cause hypercoagulation.
Too much clotting.
Too much clotting, exactly.
Okay.
Patients should be instructed to report any signs of clotting or bleeding.
Okay.
There's also a risk of myopathy,
Muscle disease.
muscle disease.
Okay.
So we may need to assess for muscle weakness or pain.
Okay.
And aminocaproic acid is also a pregnancy category C drug.
Okay. So that is a lot of information
It is a lot.
about a truly fascinating system in the body
It's amazing.
that, we don't think about very often,
Right.
but is absolutely essential
Absolutely.
to life.
To life. And it's just fascinating how finely tuned it is.
Yeah.
This constant balance between clotting and keeping the blood flowing freely.
Yeah, it really is amazing. So for our listeners, hopefully this has given you a much clearer understanding of this very important process
Yeah.
and the really significant power of these drugs
Yeah.
that can modify it.
But also the risks of those drugs.
Right, because these are very powerful medications.
Powerful medication.
And it's not something to be taken lightly.
No, definitely not.
Yeah, so it's incredible how many different ways there are to
intervene in the system.
to intervene in that system. Yeah.
Yeah.
And it makes you think,
It does.
what other things are out there
Yeah.
that we don't even know about yet?
Yeah, and that's a question for all of you listening.
Yeah.
Given how intricate this balance is of coagulation and fibrinolysis, what might be some of the undiscovered ways
Yeah.
that our body regulates this?
Yeah.
What are those future discoveries going to be?
Yeah.
And what implications could they have for treatment?
Absolutely.
There's always more to learn.
Always more to learn.
And it's a really dynamic system.
Yeah.
Yeah, and it just highlights the fact that, this is just a snapshot
Yeah.
of what we know right now,
Right.
and who knows what's going to be discovered
Absolutely.
5 years from now, 10 years from now.
Yeah. That's the beauty of science.
Yeah,
It's always evolving.
exactly.
There's always more to learn.
So keep learning,
Keep learning.
and we'll be back here to tell you about it.
That's right.